This was a large pivotal trial to establish the safety and effectiveness of the LOTUS valve compared to the self-expanding CoreValve. This was a global trial, 55 sites around the world, and we randomized 912 patients, 2-to-1, LOTUS compared to CoreValve, and looked at 30-day safety and 1-year effectiveness. The key finding of the trial is non-inferiority for safety at 30 days with a endpoint that was composed of death, stroke, kidney injury, bleeding, and vascular events, and also looking even to a year at Kaplan-Meier curves, complete overlap of the safety events for these two TAVR platforms. For the primary effectiveness endpoint, we looked at the composite of death, major stroke, and paravalvular leak of moderate or severe grade at 1 year. And we found first that the non-inferiority hypothesis was met, and that led to a pre-specified superiority analysis. We did find superiority for the LOTUS valve for effectiveness compared to CoreValve. And this was driven by a difference in disabling stroke and a large difference in paravalvular leak. We have demonstrated superiority for effectiveness, and we have demonstrated non-inferiority for safety in the first large head-to-head valve compared to valve trial. And the fact that this is such a comparison is noteworthy, and of course the findings are clearly important, and we hope will establish a basis for FDA approval of this device. There are several other findings, several things that favored CoreValve: a higher pacing rate in LOTUS compared to CoreValve, a greater frequency of malpositioning and need for valve-in-valve for CoreValve, better hemodynamics for CoreValve with higher valve areas and lower gradients, which we expect in a supraannular versus an annular device. And I think the biggest finding is the paravalvular leak efficacy, which is one of the clear strengths of the LOTUS platform.